from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. The time now is 6:23. Baptist Health's Dr. Laura Lester with Baptist Health Family Clinic in Malvern is here this morning, and a perfect topic for her is discussing the importance of prenatal care for a developing baby. Dr. Lester, of course, is having a baby this summer, and great timing to talk about healthy babies and what we can do to make a difference in the lives of our unborn children. Something that you're going through right now, have been going through. But some people don't think it's absolutely necessary, and they fail to get that care that is so important.
It's very important to get prenatal care. I mean, even if you're planning on getting pregnant, prenatal vitamins are so important. Start before you are pregnant, really, just because you want to have the folic acid and you want to have all the vitamins in. The folic acid is very important for the brain development, and nobody wants to put their child in any kind of risk for deformities or problems that could have been easily preventable with medicine.
And there are some tests that go along with prenatal care. What are some of the things that doctors can show you involving your newborn or your unborn child?
They do blood work. They make sure that there are no diseases, obviously, and then they can do some blood work to make sure that your child is not at risk for having a neural tube defect, which is developmental problems with the brain, and also Down syndrome and chromosomal abnormalities and such as that.
And even in the very first 12 weeks, there's a lot going on.
Everything happens in the first 12 weeks. I mean, a lot of people don't realize they're pregnant for 6 weeks. So that's why it's so important that even if you're trying to get pregnant, you start these vitamins, because from 0 to 12 weeks, you have the formation of all the organs. I mean, it's a miracle. So everything is getting formed in that very, very beginning stages, and that's when it's really, really important.
And that prenatal care can prepare the doctors for your delivery, should there be any concerns.
Yes. The beginning of your pregnancy is a lot more exciting than the end. At this point, I'm just, I go and they check and then I go home. But at the beginning, there's a lot more. There's testing and there's imaging and once he's developed, or she, mine's a he, once they're developed, then all they do is grow. And so the very beginning is the key stage.
And then Baptist Health is doing something to ensure that your child is healthy after it's born. Talk about this new product that
they're doing sleep sacs, and this is, there's a pink one and a blue one. I got the blue one. And so what it is a little swaddle sac for your baby, and it's to help reduce the risk of SIDS, sudden infant death syndrome. And what it is that you don't want to, you put your baby in here and then you wrap their arms under here, and it kind of keeps them still so they can't get out, but it keeps you from having to wrap them in lots of blankets that could suffocate or impinge them and increase their risk. And it also promotes back to bed,
and
that's where you want to
lay. It's pretty easy to use. That whole swaddling technique takes a little practice.
Yes, this is a zipper and Velcro, and I'm pretty sure even in the middle of the night you could do hopefully.
Right. So and every new mom is being sent
every
home.
Baby delivered at Baptist. So I will be the lucky recipient of one of these pretty soon. But yeah, every baby now born is going to get a sleep sack.
Well, great stuff. Congratulations on your pregnancy, and we'll be thinking about you, hoping for a very healthy delivery for you. And then we'll be looking forward to your return.
Yes,
in
a few
several weeks. Yeah. Okay. Thanks so much, Dr. Laura Lester with Baptist Health. If you have a question, you can always call the Baptist Health Helpline at 1-888-BAPTIST.